Hello everybody. Thank you so much for joining me today. My name is Caitlin Power. I am the Senior Coordinator of Outreach and Partnerships here at the University of Western States. I am joined today by our occupational therapy faculty to talk a little bit about our new program here at UWS. So without further ado, I would love the faculty members to please go ahead and introduce yourselves, and then we will go ahead and jump into the webinar.
Hello, everyone. My name is Dr. Michelle Tilstra. I am the program director for the new Doctor of Occupational Therapy program, and we're so excited that you are joining us and hope that you learn a lot from this presentation. I'll have Dr. Smet introduce herself.
Hello, everyone, and welcome. I am Dr. Natasha Smet. I am the Academic Fieldwork Coordinator, and I'm excited to be with you today.
Hello, everybody. My name is Dr. Daniel Martin. I am the doctoral capstone coordinator for the new OTD program here at UWS. It's a pleasure to see you here today.
Amazing. Thank you guys so much for those introductions. Let's go ahead and start with the first slide here. Let's talk a little bit about our mission statement. Dr. Tilstra, I'd love for you to talk a little bit about UWS's mission for this program.
Yes, so we designed this mission to align with the University of Western States. And so the mission of the occupational therapy program is to prepare competent, compassionate occupational therapists who integrate foundational knowledge, professionalism, interprofessional collaboration, cultural responsiveness, and leadership with a commitment to whole person health and advancing occupational therapy scholarship. And I know that's a lot of words, but actually those many of those words will pop up all throughout our curriculum because there are actually foundational themes that are woven throughout everything. And it again, it ties into the component about cultural responsiveness and whole person health is directly tied to University of Western States. They are all about that. That's why they have such a variety of healthcare programs, and we are excited to be joining in on that.
Amazing. Thank you so much. So exciting. So I'd love to hear a little bit about from each of you about what sets our program apart from other programs. And I know this is brand new, so if you want to talk a little bit about the specific curriculum or the field work, I would love to hear more about that.
So what sets us apart is that we're a two-year accelerated doctorate program. And what that means is that it's an intense program, but you can get done in 6 semesters. Now, if there's a reason why that program may be too intense or too rigorous, or there's something going on in your life that doesn't allow for that, we can definitely sit down and talk about some options because there is an option to do it in 3 years. But I would say the majority of our students will do the two-year accelerated program. The good news is you don't have to sit for the GRE. You don't even have to have a master's degree to get into this program. So many students will bridge from their bachelor's degree right into this. It's considered a clinical doctorate degree as far as a first professional degree. So that's why you can get a doctorate degree without the master's degree. Natasha, do you want to talk about the next couple points there?
Okay, so the time that's spent on campus is fairly limited. We will join up in Portland in week 11 of each trimester. So you're only really expected to come to the campus 3 times during the first year. The second year of the program, the learners are out on field work and then completing their doctoral capstone projects wherever they decide. And Dan will expound on that a little bit more. We also try to have 3 synchronous meetings throughout each trimester, and every faculty and the cohort will kind of set the boundaries for that and come up with the times that work to meet their schedules. And then we have a strong faculty with diverse backgrounds, and we really have an emphasis on cultural responsiveness and inclusion in our program. And another thing that we're really proud of is our holistic focus on students and the whole person health and mental health supports and social interactions built into our curriculum. We're going to have time for health and wellness built into our on-site experiences. And I will let Michelle finish this out for us.
Well, I actually want to talk about, because we were talking about diverse backgrounds. I know we kind of introduced ourselves, but I thought it might be fun to kind of talk about a little bit of our background. What is our clinical background, and actually where in the United States we live? Because we don't all live in Oregon, even though our program is set in Oregon. So our faculty are from, you'll learn, are from different parts of the country. And we hope that our students are from a variety of places, so that that is really built into our program to kind of emphasize those diverse backgrounds and be able to learn from each other. So for me, I actually grew up in Louisiana, so I have Southern roots, but I moved to the North Pole, as my kids said. Like, how did I move there? So I went from Louisiana to Ohio. It's not quite the North Pole, but if you grew up in Louisiana, you know, we moved from no snow to lots of it. And I have lived here for close to 30 years now, so definitely call Ohio home, and I've raised my family here. As far as clinical practice, I've done actually a pretty wide variety of clinical practice, from acute care. I've done some outpatient therapy, actually quite a few years in outpatient, and developed a specialty in hand therapy while I was doing that. I've worked in rehab settings, skilled nursing facility, home health, and now currently working in mental health, working with um, actually kids and adults on mental health concerns and trying to maximize their independence with daily activities. Maybe we'll hear from Dan, because we haven't heard much from him. So I'll have him go next, and then Natasha.
All right.
My clinical background, all the way back when, was primarily in pain management, but I practiced in ortho, I practiced in cancer, and in lymphedema as well. However, around 2016 or so, I went into regulation. I was the chairman of the Maryland Board of Occupational Therapy Practice for about a decade, and much of my time spent in that field was actually doing regulatory research. My main background, of course, is research, and it's what I continue to invest myself very strongly in as I go. To speak about where I'm from, I'm actually on the East Coast. I'm over here in Hagerstown, Maryland. I've lived in Maryland pretty much my entire life. And I've practiced all throughout Maryland. And on the side, I actually have a small research private practice where I help with all kinds of research in data analytic processes for all health scientific professions. So I'm very firmly entrenched in the research world when it comes to occupational therapy.
Great.
All right. Thank you, Dan. Well, I am based in Phoenix, Arizona currently, but I was born and raised in Johannesburg, South Africa. I've also lived in Canada, Peru, Sweden, and Germany. I am fluent in two other languages. My primary language is Dutch. And as far as my clinical practice, I've spent the majority of my clinical time in pediatric practice across various settings. I've worked in home health, I've worked in outpatient, I've worked in schools, I've worked in Head Start programs, and I've also worked in hospital-based settings. At the start of my career, to keep my adult rehab skills fresh, I worked in acute care. It's actually one of my favorite settings to work in. I appreciate the pacing. And in the last few years of my practice, I've spent time working with graduate learners who have ADHD, attention deficit hyperactivity disorder, and it's something that I really enjoy. I also enjoy working with people who've had adverse childhood experiences. And as far as my research interests, it closely aligns with pediatric practice, and then also matters of social justice. And then I have a fairly extensive line in working with graduate learners and ADHD.
Wow, yeah, thank you guys so much for giving your background. Honestly, hearing that, I feel like so impressive, first off, and also the experience that these students are going to hear about firsthand and the different, areas that they can, maybe talk to you guys about possibly going into. It's just really great. It opens so many doors to have faculty from such diverse backgrounds. So I really appreciate you guys taking the time to go through your own experience. I think it's so important. So, Michelle, I'll hand it back to you to finish out this slide.
Well, I think it's also just to kind of include our admissions team, but a lot of our admissions team do live locally in
Mhm.
Portland. So I know they've been a great resource for me when I travel to Portland. That's usually who I call to say, hey, what restaurants do you recommend? Where do you recommend that I stay? And things like that. So the admissions team has been great for that. And that's something I know that they can help us connect down the road for when our students travel to campus. So.
Agreed.
Are you from the area, Caitlin?
I'm not. So I'm one of the only people on the admissions team that is not. I'm up in Bellingham, Washington. But I
Oh,
agree. When I go down to Portland, I mean, they have been amazing and just have been able to show me around the area. And Portland is so great. So that's something that I think students really have to look forward to.
I agree. Definitely just a little tip is go see all the waterfalls. They're really fun. Do a whole waterfall walking tour.
Oh my gosh,
I'll jump back into the
yes.
exam stuff about the National Board Certification of Occupational Therapy. That's what that NBCOT exam. You will, unfortunately, if you if you do go to therapy school, you will hear about this exam quite a bit because the whole, even though you may complete your degree, you actually have to pass this exam to be able to practice as an occupational therapist. So the good news is within our program from day one, we've integrated exam prep materials. One of the programs we're using currently is called True Learn. So there's exam prep videos to watch, there's questions, and they're woven throughout multiple courses. And then as you progress in the program, you will notice that those questions get more complicated, more complex because they start to really resemble the types of questions that you would encounter on the national board exam. There will be some optional additional exam prep materials that will be provided throughout the curriculum as well because we want you to be able to succeed not only in getting your degree but in becoming a competent occupational therapist. The program learning objectives, as I mentioned when I was kind of reading that whole mission, you'll notice if you kind of scan through these, well, actually, we've bolded them for for you to specifically notice, but those are those themes that should pop out at you. And so we definitely have been very intentional with how we plan the learning objectives and the themes. It's scaffolded. That might be a word you may not be familiar with, but it just means that from the beginning of the program, we kind of start with some entry level foundational information, but then as you grow through the program and learn more, you get deeper and deeper into the content so that by the time you graduate, you will have accomplished all of these things. All the way through number six, which is leadership skills to manage occupational therapy, clinical or academic programs effectively. So um, we have high aspirations for our students and really challenge them to kind of aim for that. But we also put in supports to kind of help you get there along the way. I don't know if either one of you want to add any more to that.
Item number two, contribute to the advancement of scholarship, is something that, as the doctoral capstone coordinator and also the developer of all the research content for the program, I take very seriously. And my goal that I'll expand on when we start talking about the doctoral capstone coordinator is to make an expert out of each and every one of you. I've designed all of the research coursework to not only develop your capstone idea as you go along, but to teach you very valuable skills about how to develop and cultivate expertise in whichever specialization or area of practice that you're interested in. So the courses are designed, the research courses, to teach you not just how to research, but how to do important ancillary tasks around scholarship, such as publication, presenting, data analysis, how to form very strong research questions, and all the things that are very important for you to leave this OTD program and easily demonstrate your expertise. And this is all to give you that step up beyond the master's of the OT degree that will set you apart from your peers. So we'll talk a little bit more about the advancement of scholarship here shortly. But that's among the most important dimensions of this program that we've placed heavy emphasis on.
And I
Thank
think that's
you.
good, Dan, that you emphasize because that is what sets our program apart as well, as far as a doctorate level program. Because if you are looking, you're trying to decide between a master's and a doctorate level, this is something that you should really kind of pay attention to, because in a master's program, you're not going to have this level of expertise supporting you along the way and kind of teaching you those skills to be able to contribute to scholarship when you graduate.
Right. And a master's of OT degree, to be very clear, is about preparing you to be a entry-level clinician solely. But the OTD degree doesn't just prepare you to be an entry-level clinician, it also prepares you to be a leader. It also prepares you to be an expert at whatever skills you want to cultivate throughout the scholarship and capstone process of the OTD degree. So it places you kind of at a higher level playing field than the master's degree otherwise would.
And as a person who holds an entry level OTD degree, I will say I definitely felt a little bit better prepared, having my capstone focus on working with children, and especially children who had experienced trauma. When I entered my first clinical job, I had all kinds of skills that maybe some of my other colleagues didn't have coming in. And so that was very beneficial to me. It also helped me on my path to academia a lot sooner in my career than I expected. And fairly early on, I was able to teach at a local occupational therapy assistant program. And that was a definite benefit to me, being an OTD degree holder at the time.
Awesome. Thanks for sharing.
Yeah, thank you guys so much. Right. We will go on to what the first year curriculum is going to look like for an OTD student.
Okay, I'll talk about the first year. I mean, the first thing that kind of sticks out to you are like, what are all these teal highlighted courses? So if you look at them a little closely, they should say either they are have a lab component to them or a clinical component. And what that means is those three, like that very first semester, it's functional anatomy, evaluation skills in occupational therapy, and the mental health level one field work. When you come to campus for that 1 week intensive that Natasha explained, that will be the focus of that week, is that you will be doing labs that are associated with those courses. So the anatomy and evaluation skills will have 6 hours worth of lab time while you're there, while the mental health level one field work will have, I don't know, 28 to 32 hours. It kind of varies depending on the semester, but that will have simulations and some very specific clinical experiences that I know Natasha's going to explain to you in a little bit, so I don't want to steal her thunder. But if you move on to the second semester, actually the next 2 semesters kind of mirror that, as far as there's usually 2 courses that you're going to have 6 hour labs, and then 1 course, which is a level one field work where you're going to complete it while you're on campus. So the good news is you don't have to find those level one field work experiences. That's Natasha's job. It's already set up for you. It aligns with our curriculum, which is actually a really important accreditation standard that we have to meet. So all the students who come to campus or come to this curriculum will have very similar level one fieldwork experiences. Again, Natasha will talk about what those level two experiences are, because they're set up differently. As far as the content for each of the courses, you will see that the content starts initially with some foundations courses. Professional communications, I would consider is pretty foundational, but at the same time, you're actually engaged in some clinical courses. And some programs don't set their curriculum up like this. So just to be aware, when you're looking at curriculums, you want to kind of think about the processes and have they been intentional about the way they've scheduled it. And my answer would be absolutely yes, we have. We've aligned objectives. We've looked at everything as far as even down to each week, what's happening in each course to make sure that they're sequential in the learning process, so that we are trying to help you be able to learn from the foundation, but then turn around and be able to apply those skills right away. And definitely during that week 11 when you're on campus, that will be, we call it intensive because we mean that the whole time you're there, your hands are doing something. There's not going to be a lot of time of sitting around listening to lecture. That's all done online remotely. When you're on campus, we want to be really efficient with your time and feel like it's been a good use of the time and the travel expense to get there. So again, every component of that, every hour is very intentional with the planning. I'll just give the highlight because again, Natasha's going to explain, and Natasha and Dan will go into details of this. So just looking at it briefly, basically, again, those teal courses are your full-time clinical fieldwork or capstone. And they will explain the differences of what that looks like. Just to keep in mind, though, that even though you're at a full-time clinical experience, you still have a couple of courses that you are having to complete online. But again, they will be online, predominantly asynchronous. Natasha did mention that there's some synchronous requirements, but those can be pre-recorded. So we're trying to accommodate, again, students who are in their clinicals or maybe have childcare or other life things going on, as we all do, to try to make it as accessible as we possibly can. But that's the way we can do this also with partnering these courses together to ensure that you get everything you need in preparation for that capstone project that's in the last semester so that you graduate at the end of semester 6 there.
Awesome. Thank you so much. We'll go ahead and move on to the level 1 field work here.
All right. This is really an exciting part of, the leap of bridging that theory and practice. So level 1 fieldwork at the University of Western States is a 3-day scaffolded experience integrated throughout the didactic curriculum. As we've mentioned, this carefully designed program fulfills the Accreditation Council for Occupational Therapy Education, or ACOTE. You'll hear us use that terminology. Their directive to really introduce students to fieldwork, to apply the knowledge to practice and develop understanding of the needs of the clients and the community members that we serve. These experiences really effectively bridge that classroom and clinic by transforming the theoretical concepts into practical application. And our learners will engage in clinical activities across both traditional and emerging practice settings. And for level 1, we really will be gaining exposure to the full spectrum of contemporary occupational therapy. So it is strategically positioned during week 11 of the curriculum, where the level 1 fieldwork will provide optimal timing for that reinforcement of the didactic content through the hands-on application. Like Michelle mentioned earlier, this is going to be a busy and exciting time. By now the learners have accumulated substantial theoretical knowledge, and it's so exciting when we come together as a community on campus and do all this new learning. And all placements occur either through simulated experiences or within the greater Portland area, so ensuring accessibility while we maintain high quality and rigor of our curriculum. So our learners are supervised by diverse qualified professionals who meet ACOTE's rigorous standards, and we provide varied perspectives and specialties that enrich the learning experience and prepare you for your future career. So in that very first semester, level 1 will be supervised by your faculty, and we will be doing some fun things like an intra-professional learning experience with occupational therapy assistant students in another state. We will also have the opportunity to engage in something called a human library. And then we're going to have a bunch of fun activities such as role playing and also simulated experiences. And that's just a short and brief taste of that first trimester. The second trimester, we're really focused on physical disabilities. And again, we'll be getting out into the community. We're targeting about 30 to 40 miles maximum from the campus, but really connecting with the greater Portland community and establishing those relationships and learning about working with other disciplines that's not specifically occupational therapy related, but definitely adjacent. And what does it look like when we work in interprofessional teams? So working with people outside our discipline is a great learning opportunity. And then in that last trimester, it's all things pediatrics, and I will be leading that. And it's a very exciting course. And of course, I have a bias because that's my preferred practice setting. So I really look forward to that. It's especially the pediatric one because I think you get to get messy and have a lot of fun while you learn. Level 2 really is an opportunity for us to advance those clinical experiences. So following the successful completion of the required coursework and the level 1 field work, the learners advance to the culminating phase of their clinical education through 2 comprehensive 12-week level 2 fieldwork placements. And these extended placements or rotations represent a critical milestone as successful completion of both placements, which is mandatory for graduation. The University of Western States has strategically developed an extensive network of contracted practice sites across the United States, so offering learners access to diverse clinical environments and which serve clients across the lifespan. So we can start as early as the neonatal unit all the way through older adult stage and then end of life stage. And we are in the process of also looking at pre and post menopausal placements, and then also trying to get some maternal mental health placements. These are emerging practice areas for us. And so this broad geographic reach ensures that students can gain experience in various settings while accommodating their personal and professional preferences. And I'd like to talk a little bit more about that. So the placement process empowers the learners to take ownership of their professional development by identifying their preferred level 2 fieldwork sites based on their individual interests and then their career aspirations. However, this learner-driven selection process operates within a structured framework that balances their personal preferences with program guidelines, site availability, and the comprehensive requirements established by UWS and the ACOTE standards. So this collaborative approach to fieldwork placement ensures that learners receive meaningful clinical experiences aligned with their goals, while also meeting the rigorous educational standards necessary for professional competency.
Dr. Smet, what if I only like pediatric patients. I really don't want to work with old people. What would you say to that? Can I do both of my level twos in pediatrics?
Absolutely not. While that would be wonderful, that is not going to prepare you to sit for a national board examination, which expects us to have experiences across the lifespan. And I would often suggest that every learner have exposure to an adult rehab facility. I think that really helps you prepare for that national board examination. So thank you for asking. And that is something that I am a stickler for. You may absolutely not have to be at pediatric placements. But if that is your special interest, I don't see why that couldn't be the focus of your capstone project.
And I know as a past fieldwork educator to academic fieldwork coordinator, sorry, and a fieldwork educator. But I have had other students that have come to me and they literally have a fear of children, have never been around them, don't really want to work with them. And so I would think, in which I'm going to propose this and see what your thoughts are, Natasha, just to, I mean, definitely feel free to disagree with me, but I would never, I didn't want to intentionally put a student into a fieldwork site where I knew that they were going to struggle the entire time. But I often challenge students to think outside of kind of what they're comfortable with. We do want them to push their boundaries, but I'm not going to put them or suggest for them maybe a NICU or an intensive care unit for pediatrics. Perhaps we would look at a school setting or another placement where they could still get experience with pediatrics, but maybe not to be in the intense level that other students may really want that experience. So definitely still having that collaboration, but also encouraging that holistic view, making sure that you have experiences so that you can pass the national board exam. Because if you have zero experience in pediatric throughout your whole occupational therapy program, then we've done a disservice to you, honestly, as a student. What are your
Absolutely.
thoughts?
I
Okay.
I I definitely agree with that. And as the faculty get to know the learners, usually we form personal relationships and we can sort of gauge where the learners are at. And we might even say, this might not be the best placement for you. Some learners come in and they're adamant about certain things. And while we want to support that, sometimes we recognize that we're doing a disservice to the learner. So I think being really attuned to the learners is important. And this is definitely a caring community. And so we wouldn't want to put the learner in harm's way if we know that's going to cause them extra stress at an already stressful time. That wouldn't be the best for their mental and physical health. And so they're not going to perform as well, possibly. And you will have an opportunity to be exposed to different clinical, well, pediatric experiences in the level one, but I think the courses are also built in such a way that you will have a well-rounded experience. And certainly we can look at sites that has a lifespan approach. We do have some placements where the students can rotate into different floors at a hospital, or we have facilities that offer things such as equine therapy that does cater to a younger population, but then they also see older adults at the same facility. So we also look at very clinical sites when we try to establish new contracts. And certainly we are always open to suggestions if you have people in the community that you know of. But one of the things that we want to establish as the program kicks off here is that at no point is a student supposed to contact a site on behalf of the university. You would let me know that you know of a place, and then I would have to contact the place and establish a contract and work through the proper channels to establish a new contract. So it would be inappropriate for a student to take that on. That really is my job. And so I'm happy to do that. If there is a place that a student would want to go to and we just don't have a contract with that site. That said, we also have to be really mindful with the fieldwork selection process. It is a conflict of interest to be supervised by a family member or at a facility that you once worked at. So those are things that we would need to take into consideration when placement occurs.
Great answer. Thank you.
All right, am I good to move on from here?
Sure, I could ask questions all day, but we don't want this to
These
be a
are
2 hour.
really no, these are great. And they're
Okay.
really going to be helpful, I think. So I appreciate it. Well, let's jump in and talk a little bit about the capstone that the students will be fulfilling at the end of their program.
So the capstone is a process, and what the capstone refers to is a process in which students develop an expertise in whichever specialty, whichever niche area of practice, whichever major area of practice that they're interested in. And most students enter an OTD program with an interest, with a goal, something that they want to develop expertise in right out the gate. Commonly, this is things such as pediatrics or research or a specific area of practice that they want to become greater than average at by the time that they leave the OTD program. So students, they develop a capstone topic, and we begin developing a capstone topic as soon as the second semester in the first research course. And these topics, they're cultivated based upon your personal, clinical, research interests, whichever they may be. And I work with you personally in order to refine that early idea into what we call your capstone idea. So the students will design either an executable research or program development project around this capstone idea. And we begin to develop that solid project in earnest by the beginning of semester 4. So we actually spend 2 semesters in total taking your capstone idea and turning it into an entire blueprint that you can take out into the community and execute to essentially progress OT evidence, but also for humanitarian purpose. This execution of the capstone is a 14-week process, and it's done under the supervision of a lot of key players. It's done under my supervision, the doctoral capstone coordinator, but it's also done under the supervision of another faculty within UWS and also the mentor of a site that you go to for that 14 weeks to execute the project. So, to speak briefly about the site process, it's a little bit different than the fieldwork process, and it's much more flexible. So generally, we can't figure a site out for you for the capstone process until we have a solid capstone idea. So we spend much of the 2 classes in semester 4 and 5, once we finalize your capstone idea, working together, you and me, to secure you a site wherever in the world you want, at whatever practice area you want. So we work together and we will reach out to sites together and secure the interests of sites, secure contracts, and get you familiar with the process of reaching out to sites in order to achieve some sort of research or programmatic outcome. The process is part of the learning experience of the capstone, which will make you more comfortable reaching out to stakeholders and doing things such as pitching projects or making your services valuable to other stakeholders out in your community. So we've placed students all over. In previous jobs, I'm an experienced capstone coordinator. I've placed students a mile away from their house. I've placed students in other countries out in the world, including Uzbekistan and Nepal. So wherever your capstone idea, wherever you want it to take you, we will work something out together so you get the absolute most out of your capstone experience. So as mentioned before, students can choose any clinical or community site nationally. It can be a mile away from their house. It can be 10 miles. It can be 100 or 10,000 miles from their house, wherever they would like to execute their 14-week capstone project. And to be very clear, when we secure a site, these sites can be traditional clinical sites, such as hospital settings, outpatient settings. They can be fully virtual settings. I've placed students in fully virtual settings for maternal health before, for postpartum health. There are numerous virtual sites that we can reach out to. And we can place students in sites that may not even have an OT on staff. I've placed students at ADA consulting firms, at federal government sites, and all kinds of sites where an OT would be sorely needed, but they don't have the means to secure one. And your presence makes a huge difference at these sites. A huge enough difference where many of the students that I've placed at capstone sites without an OT have gone on to create a job for said student as an OT once the capstone experience is finished. So the capstone experience is a very good job for you to connect and make new things happen with stakeholders out in your community. The capstone process also involves what we call the capstone paper. And to be very clear, the capstone paper is not a dissertation that's 200 or 300 pages long. It's instead a manuscript length paper that has the traditional literature review methods, results, discussion, but it's written in a very slick, short way that makes it immediately publishable to scientific journals. So the other half of the capstone experience, in terms of its philosophy, is establishing your expertise so you can enter the world of OT very easily demonstrating that expertise. Whether you take your successful capstone project and you publish it to the American Journal of OT or the OT Journal of Research or the Journal of OT Education, or you can present your results at national AOTA conference, at state level conferences. Um, or you can disseminate it in numerous other ways so you can establish your expertise to employers or to clients of yours, should you open up a private practice, very easily and very successfully. So ultimately, the capstone allows you, the OTD student, to establish expertise in whatever area of specialty you want before entering the field, with supervision, with guidance of people who have been there before, and with the background of UWS faculty in matters of clinical practice and research. That's going to place you at an advantage when you enter the field. And we've placed, if your interests are in women's and maternal health, pelvic floor therapy, research, leadership, diagnostic tool development, academics, hand therapy and orthopedics, neuro, clinical education, we will work together and find a site for you. So the capstone process ultimately puts your names in lights so you can enter the field at a leg up over your, say, master's contemporaries.
Great. And it sounds like just an incredible networking experience for those students to,
Oh,
yeah, to go right
absolutely.
into the field. So that's phenomenal. Thank you so much for going in depth on the capstone. Next up, we do want to discuss some of the admissions requirements.
Yeah, right now our admissions requirements are we tried to keep it pretty minimal, but keeping in mind that you need to have a really good foundation to be able to come into a rigorous accelerated OT program, an OTD program. So having a bachelor's degree in biology, psychology, exercise science, or pre-healthcare, I would say that would be the preferred, although there are definitely, I've had many students who came from like a teaching background. I had somebody who was doing fashion design. I've had, I'm trying to think of a different varieties, but definitely from all different areas that, they just kind of graduated with a degree and then said, you know what, I don't want to do that. I want to do something completely different. And so, if you do choose to do that, though, we would want you to make sure that you have some prerequisites in abnormal psychology, human development, statistics, and human anatomy. And that abnormal psychology is abnormal psychology or human development. I prefer abnormal psychology, but either one will work, just to let you know. But then the other group of people that we really would love to have in our program are practicing OT assistants, because they generally have an associate's degree to be able to practice as an OT assistant. So you would have to take some additional courses on top of your associate's degree, but you could get to 90 credit hours, which may or may not get you the full bachelor's degree. So we're not requiring a bachelor's degree, we're requiring the 90 credit hours. So definitely kind of talk with the admissions counselors about that and how you could go about doing the application with that. In the process of the application, we are going to ask for two professional references. That means you're going to provide names and email addresses and phone numbers, and we're going to send them out a form to complete. So they don't need to sit down and write you a full letter. There's a form. It's pretty quick and easy, so you can kind of warn the people you're asking where they don't have to write a dissertation for you. It can be pretty quick and easy. And then if you've kind of met the qualifications that we are looking for a student. And basically that means you have a general 3.0 GPA, that you've shown some interest in occupational therapy, that you know what it is. That's kind of key. That's important. But that your professional references also support you in going to this rigorous program. Then we would invite you for an interview, and you would interview with a couple of the faculty. We would ask you some pretty basic questions about the OT profession and just kind of try to gauge your interests, but also like social dynamics and how you participate and how you handle stress. So it can be kind of a variety of different questions that we ask during that interview. And then from that point, we would make a decision on admission. Now, this first admission cycle, I will just let people know that because of the way the accreditation is set up, we are not allowed to notify students that they are admitted until after August 15th. So if you interview anytime before then, generally we say if you have not heard from us, probably good news, but we can't officially tell you that you're admitted. So, but we can tell you if you're not admitted. So take that for what it is. So we would definitely try, stay in touch with you, try to keep you engaged with our program and our faculty and getting to know other students. But if there's a delay in that notification, that is why we're kind of we're held to that standard.
Thank you so much for talking through those points. And you kind of already touched on this about like what the ideal student would be for this program. So I really appreciate you going in depth on that. I am curious about the accreditation process and where UWS stands right now, if you don't mind talking a little bit about that as well.
Oh, that's a great question. Yes. So the accreditation process for occupational therapy programs is quite extensive, which we want it to be. We want programs to be held to a high standard. So there's a significant time and financial investment on the part of the university up front. Just so you know, like I've been hired more than a year ahead of, actually 2 years ahead of when the students start to start developing the program. And so that's the beginning of kind of the financial input, the financial output, I should say, from the university to get this program going. But they also have to pay accreditation fees along the way. And then, of course, we've hired Dr. Smet and Dr. Martin to collaborate in building this program. So we are considered in the application phase of accreditation, which means that we have completed all the documentation that we need to get a candidacy status. We have submitted it. That was actually submitted back on April 15th, 2025 was our deadline. And we're waiting. We have to wait until that August 15th to know if we're officially granted candidacy. So, but in the meantime, we have been communicating with them. If there's anything they have questions about, they definitely let us know. And we have no reason to believe that we would not be granted candidacy. After we're granted candidacy, we can admit students, we can start students in the program, but behind the scenes, what's going on is we're continuing to complete even more documentation, pay more money for accreditation, add more faculty in that process, and then the accreditors will actually come to campus at a time that we're on campus. They will want to interview students, they interview faculty, they look through all of our curriculum, all of our documentation, and then they will grant us, assuming we have met all of their standards, they would grant us full accreditation. That will occur in August of 2027. So, and that is before our first class would be scheduled to graduate in December of
Right.
2027. So, like I said, it's kind of an extended process for a reason, but the ACOTE is very good about letting programs know up front if they don't think that they either have the financial resources, the faculty resources, or the curriculum justification to support a new program. They they advocate and sit in all of our meetings, tell us that they would be very upfront in letting us know that they do not think this program should move forward. So I am assured that if we are granted candidacy, that we are moving in the right direction and should have no reason to not be granted full accreditation.
Awesome. I really
I see
appreciate you. Yeah,
Oh,
going through.
sorry.
Oh no, go ahead. I was just gonna say I really appreciate you walking through those steps, and it's just it's a lot, but it's so exciting for UWS. So I'm truly really excited to be able to see the growth of this. And yeah, do any of you have anything else to add on that process?
I was just thinking, in in my previous experience working for other OTD programs, first off, as Dr. Tilshire had said, we receive a very broad palette of students with previous experiences. I've worked in cohorts that a third of the cohort were dance majors, who had graduated and come back to school. Many teachers, many OTAs, biology backgrounds, some statistics backgrounds, all kinds of degree holders are generally very successful in an OTD program. The second thing that I want to mention is that this not being my first time having worked in a program where we worked from the ground up to get accreditation, um, this program is working very diligently with three very experienced founding faculty members, which is the three of us. We've seen this movie before, and we've designed this program to be as successful with the accreditation process as possible. And when programs are going through the application phase and the candidacy phase and approaching the final phase, this is entirely normal for an OTD process to go through or an OTD program to go through. And what we have developed here at the UWS OTD program is a culmination, an accumulation of decades of experience in the field, not just practicing, but in academics to make sure that this program is as successful as it should be in terms of not just accreditation, but making you a valuable and competent OTD. So when students hear that a program is undergoing accreditation, that doesn't mean that the program is unfinished or unworthy. It's just going through the necessary steps that are almost always successful in terms of you leaving the program with a degree that will enable you to take the board exam.
Yeah, that's a really great way to put it. I really appreciate that insight as well.
I feel really fortunate to work with this particular team and the knowledge. And I know that Dan touched on it, but we really have experienced faculty. And I mean, these are industry leaders and experts. And so I also feel just incredibly fortunate as a faculty member to have this level of expertise. I know that I've joked and my colleagues know this, but I always say I think becoming a certified hand therapist is one of the hardest things you can do in the profession, and to have that expertise on the team is really invaluable. And also, I think Dr. Martin is stuck with me for life, whether he likes it or not, for his expertise. I mean, stellar analytics, data analysis. You want your stats person. The go-to stats person is Dr. Martin. I feel so fortunate to work with two of the best. And I'm not just saying that. I am a very picky person. And I think in the profession it's well known. I'm highly selective about who I like and who I like to align my professional identity with. And so I just feel really fortunate to have these experts on the same team. And I think that's really wonderful to just have this level of expertise. And so I feel that the learners benefit from having, the expertise that we do have in our small but mighty team.
I
That
couldn't
will be
say it better
growing. That will be growing, I
Yes,
promise.
exactly.
And I will, because, Natasha didn't want to brag on herself, but I will brag on her because I've actually been to a national conference now with her, and she knows everyone in the OT world. And that is who you want to be your academic fieldwork coordinator, because
Yes.
her networking skills are beyond anything I have ever seen in this profession or any other profession. And I see Dr. Martin agreeing with me because he
Yeah.
witnessed it as well. So
Amazing.
if Dr. Smith cannot find you a fieldwork site, it is because it does not exist. I can promise you that. She is the networking queen. So and her experience, clinical experience, and academic experience really contribute to our team as well. So I would agree with her comment as far as I could not have dreamed up a better faculty for this program and developing this program and working together for the good of the students. And that's really what we're passionate about. So
Yeah.
I hope you consider UWS and please let us know if you have questions. Caitlin can help you find us through oh yes, all the
Yes.
socials and the website and everything.
Please, yeah, and we have a phenomenal admissions team as well, and admissions counselors who are at the ready, wanting to connect with prospective students about the application process or any other questions that you guys have. So please, 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 email us, give us a call. That's what we're here for. But I want to thank the three of you so, so much. Just one of the many reasons I'm so proud to be working here at UWS is hearing all the phenomenal things that are about to happen with this program. I'm so, so grateful and so excited that we were able to sit down today. So, thank you guys again. And yeah, we will see you guys in the fall.